I think Vibha will be starting the
Yeah.
session.
Okay. So, hi everyone. I'm Vibha from representing Bear Foundation of India, and I'm overseeing this Discovering Hand project, which is being implemented by our partner organization, National Association of Blind India. So the project what we are going to implement is Discovering Hand. So Discovering Hand is a Bayer's CSR initiative with the support of Bayer medical tactile examiner went for undergo for a 9 month extensive training program. So the purpose of this program is to detect the early breast cancer symptoms among the women with the age group of 25 to 40, if I'm not wrong, Sonal. Is this correct? Okay. So with the help of this program, we are also trying to build a awareness session as well as bring more information on breast cancer among the women as well as not only women but as well as the men also because they are also in one of the influential part of our society. So from here onward, I would like to request Sonal to take you through with our project and introduce like the speaker of our session, Dr. Mandeep. So over to you, Sonal.
Thank you so much, Vibha. Good evening, everyone. I am Sonal from NAB India Center for Blind Women. And NAB India Center is based in Delhi since 2002 and is the pioneering organization dedicated to provide training and rehabilitation services for blind women. Uh, we have various training programs here under which we aim to empower blind women by training them with necessary skills and knowledge, which helps them to lead an independent and self-reliant lives. I would like to share a PPT with you. Is it
Sorry
visible?
to interrupt. Yeah, it is visible. So, no, sorry to interrupt. Actually, I forgot to mention, like, if during this session, so many people will be coming up with their queries and questions they will be having. So, note down their questions. We will take queries at the end of the session, and it will be dedicated for 10 minutes. Okay. So, sorry, Sundar, you can go ahead.
It's okay, no, not a problem. So, as we all know, that breast cancer is a very important topic in our life as a women, because breast cancer is one of the prevalent and deadly disease which uh, in India, like we are getting more number of mortality of women because of breast cancer. So we are here to discuss about that and to uh, introduce you all with Discovering Hands India program. So before going further, we have Dr. Mandeep Singh Malhotra with us. He is the head of head, neck and breast oncoplastic department of CK Birla Hospital, Punjabi Bagh. He has received his training in surgical oncology from Institute Rotary Cancer Hospital, AIMS. He further trained himself in head neck oncology and microvascular reconstruction from Mazumdar Shaw Cancer Center, Narayana Hrudayalaya, Bangalore. He is also specialized in post mastectomy, breast reconstruction, and breast oncoplasty from St. Andrews Hospital, Chelmsford, UK. He had also worked as a fellow in Department of GI Minimal Access Surgery at BMHRC Bhopal. His areas of interest are head, neck, and thyroid cancers, breast oncoplasty, and post mastectomy reconstruction. He has also represented NAB Discovering Hands India at Zero Project Conference 2019 in Vienna, Austria. With his expertise, he can shed light on the significance of programs like NAB Discovering Hands India and how we are aiming to create awareness about breast cancer and provide accessible breast screening for women. Over to you, Dr. Mandi.
Thank you, Sonal. So, a very good afternoon to all of you. So, as Sonal has introduced me to you, that I am the clinical lead for the Discovering Hands program in India, and she was aptly correct in stating that now the most common cancer affecting Indian women across socioeconomic strata, maybe low, maybe high, is breast cancer. And the issue with breast cancer in India is that over the past few years or last 2 decades, not only the incidence of breast cancer has increased, the other issue is that the mortality due to breast cancer has also increased. This is different from what we are seeing in the Western countries. In Western countries, yes, the incidence of breast cancer is much higher than what we have in India, but the survival rate for breast cancer is also much higher than what we have in India. The issue is that in India, majority of breast cancer patients, that is like 50 to 60% of our women would be diagnosed at advanced stages. The percentage of women who are being diagnosed at early stages is still very less. And the difference lies is that if I have a woman who is diagnosed with breast cancer in stage 1, stage 2, the survival after treatment is as high as 80 to 90%. Whereas if I have a woman who is being diagnosed in stage 3, the survival drops down to 50%. If a woman is being diagnosed at stage 4, obviously we cannot cure it. We can just increase survival for with the treatment available. So that is the core issue of the problem. And how to solve this problem? The solution lies with early detection. And also, before we get into early detection, there is few points on just a general awareness that why breast cancer in particular has increased over the time. Yes, other cancers have also increased, but why breast in particular? Breast in particular is why the reason is that as we might understand that breast is just not a static organ in the upper part of the breast. It is a very, very dynamic organ. It undergoes a lot of changes throughout the human lifespan. So the bud is laid in utero, and then when the puberty comes, then there is a hierarchy that the breast develops. Then there are certain changes which occurs in adolescence. Then there are certain changes which occur in younger age when sexual life starts. There are changes which occurs during pregnancy, during lactation, post lactation, then during pre-menopause, menopause, after menopause. Even in every menstrual cycle, there are certain changes which occurs during the first half of menstrual cycle, and then there are certain changes which occur in the other half of menstrual cycle. So these are so this the breast as an organ is a very dynamic and it undergoes a lot of changes during a lifetime and also in between our lifespan, even during the menstrual cycle. So the more the changes, the more chances that a mutation might occur and it can go wrong. And obviously with the newer lifestyle which we are having, so the pregnancy is delayed, number of pregnancies lessened. And obviously, this is not that we advocate that we start having early pregnancies or we have more number of children. It's just that the circumstances and lifestyle is like that. But the main issue is that one pregnancy definitely decreases the incidence of breast cancer by 30%. A good, timely, adequate lactation also decreases the incidence of breast cancer. The environment which we live in, the lifestyle which we are, the smoke in the Delhi smog. So the carbon in the Delhi smog binds to the estrogen receptor in the breast. The DDT and pesticides also in our food habits or whatever is available, the water, the food. Also, these also bind towards the estrogen receptors in the breast. When a woman is in stress, there is more estrogen. So more estrogen means more hyperestrogenemia, means more chances of stimulation of estrogen receptors in the breast. Similarly, high stress, obesity, alcohol intake, smoking. So all these are factors which have led to increased level of estrogen, and with increased level of estrogen, the chances of breast cancer is much, much higher. And then there is a small component of familial, that is hereditary breast cancer, which is around still 10 to 15% of Indian women have breast and ovarian cancer, which runs in family and which needs to be picked up. But amongst all these things, yes, if we can change certain lifestyle, that is good. But more than that, the best thing is that if we are able to detect it early, and when we are looking at detecting it early, so now can you just go to the next slide? Our first thought when we are talking about early detection of breast cancer is that we'll think about mammographies. Now, mammography in particularly in Indian subcontinent, in Indian scenario is not very effective. The reason is that in India, the peak age of breast cancer is around 45 years. So when you look into the American Society recommendations, the recommendation says that the mammography should be started from 40 years plus or 45 years is what we are recommending. So if my peak age of incidence of breast cancer in Delhi NCR in India is 45, so I need to start screening 10 years at least before that. So at 35, anyway, mammography is not effective. The other important issue with mammogram is that even at the age of 45, 50, Indian women in by character have more denser breasts. So denser breast means that, so mammography is just an X-ray of the breast. So how this age 45, 50 comes into the picture is that when a woman is younger, around 30, 35, or even 25, 40, so the breast is mainly composed of milk ducts. And as the woman nearing menopause, the breast ducts get atrophied. Sorry, the breast gets atrophied and it is replaced by fat, and that is when we click a mammogram, we're able to detect a cancer. Whereas in Indian women, the ductal atrophy, the mid ducts atrophy gets lesser. It is lesser by the nature of our inherent nature. So that is why the mammography is not effective. So the best scenario for us actually comes when we say that a self-breast examination or a detection by examination by either by yourself or by trained medical personnel, maybe doctor. And then comes the examination by the medical tactile examination. So what by this concept is that in medical tactile examination, as Sonal will explain you further, we have trained visually impaired females. So, as you understand, if somebody is visually impaired, so the touch sense, the tactile sense becomes better. So, when the tactile sense becomes better, they are able to detect breast cancer or of changes in the breast at much smaller sizes, much earlier. And also, they are trained to teach the woman how to do a self-breast examination. So that is how this combination starts to play. That is, they would tell women how to do a self-breast examination. They would look into the lifestyles and family history, so they'll be able to identify if some woman needs to be identified of a familial list. And then they'll obviously do a very thorough examination of breast, which Sonal and his team and her team will explain you, and how thorough they are in examining breast. That they are examining every centimeter of the breast. They are looking at at breast in, I would say, three pressures, and they would be able to detect the superior, the middle, and even the deep part of the breast tissue to see any changes are there or not. And that is how methodical they are. And I'll take it further once this Sonal and her team has explained you how they go about doing the medical tactile examination that we term as tactile breast examination. Sonal, please.
Thank you so much, sir, for sharing this detail about breast cancer. So I'll explain about Discovering Hands. So Discovering Hands is an innovative program where we train blind and low vision girls to use their superior sensory touch to detect early signs of breast cancer. So this was developed by a German gynecologist, Dr. Frank Hoffman. The aim of this program is to provide accessible breast screening for women who are under 50, under 40, and are not covered under mammography in Germany. But in India, we have started this program in 2017, and we have been training since 2017, and our four batch has already completed the training, and they are working in different hospitals. So as Dr. Mandeep has already explained that the blind and low vision girls have a very strong tactile sense. So that's why we have chosen blind and low vision girls for this program. And one examination takes around 30 to 45 minutes, and they can detect abnormality which is as small as 0.5 centimeter. So I have Neetu with us. Neetu will explain how she do the examination to give you more detail about what is going to happen when you register yourself for the examination.
थैंक यू सोनल मैम। हेलो एवरीवन, मेरा नाम नीतू गर्ग है और मैं हापुड़ यूपी से बिलोंग करती हूँ। मैंने नैब इंडियन सेंटर दिल्ली हॉस्का से 2016 में डिस्कवरिंग हैंड्स का कोर्स किया है और उसके बाद मैं एज अ एमटी वर्क कर रही हूँ और सब कुछ सर ने और मैम ने बता दिया है। अब मैं आपको अपनी टेक्निक के बारे में बताऊंगी। तो जब भी कोई लेडी हमारे पास एग्जामिनेशन के लिए आती है, जब भी कोई लेडी हमारे पास एग्जामिनेशन के लिए आती हैं, सबसे पहले हम उनकी पेशेंट हिस्ट्री लेते हैं, जिसमें कुछ जनरल क्वेश्चन होते हैं आपकी लाइफस्टाइल और आपकी फैमिली हिस्ट्री से रिलेटेड कुछ क्वेश्चंस होते हैं। उसके बाद हम एग्जामिनेशन स्टार्ट करते हैं, जो कि पहले सिटिंग पोजीशन में हम कुछ लिम्फ नोड चेक करते हैं, लाइक सर्वाइकल एरिया के और क्लेविकल एरिया के एंड एक्सिला के। उसके बाद ब्रेस्ट का टेम्परेचर चेक करते हैं और ब्रेस्ट की स्किन में कोई भी चेंजेस है उसको अपने हैंड से फील करते हैं। उसके बाद जो प्रोसीजर होता है वो सुपाइन पोजीशन में होता है और उसके लिए हम एक स्पेशल टेप यूज करते हैं, जो जैसे आप देख रहे हैं ये डमी है, डमी पर ये टेप लगी है, इसको बोलते हैं डोकोज। डोकोज मीन्स डॉक्यूमेंटेशन एंड ओरिएंटेशन सिस्टम। आप देख सकते हैं इस पर कुछ डॉट्स बने हुए हैं और कुछ बॉक्स हैं डिफरेंट कलर के। ये डॉट्स हैं, 4 डॉट हैं कुछ और कुछ।
So for everyone, this is that tape. Is it visible?
Yes.
So as you can see, this tape is having 3 colored boxes. One is white. White have 4 dots. The red one is blank, and the black one is having 3 dots, braille dots. Yeah.
जैसे कि आप देख सकते हैं इस पे कुछ 4 डॉट हैं और कुछ 3 डॉट हैं, लाइक 3 डॉट एंड 4 और इन्हीं की हेल्प से हम पूरा प्रोसेस करते हैं एग्जामिनेशन का। मैं करके बताती हूँ आपको। डोकोज की हेल्प से हम ब्रेस्ट को 4 पार्ट में डिवाइड करते हैं और जो 3 डॉट्स है उसको हम 0 पॉइंट मानते हैं और एक दूसरे के सामने बिल्कुल सीधा उसको लगाते हैं। अब मैं एग्जामिनेशन करती हूँ। अपने फिंगर के टिप से हम एग्जामिनेशन स्टार्ट करते हैं। दोनों हैंड से, लेफ्ट हैंड मेरा लीडिंग हैंड होगा और राइट हैंड मेरा फॉलोइंग हैंड होगा। इसकी सहायता से मैं वर्ड करूंगी 1 2 3 then 4 5 6। ये 6 वर्ड्स हैं, इनको एक प्रकार का डांस है ये। और 4 5 6 इनसे मैं प्रेशर दूंगी ब्रेस्ट पर, जो कि 4 इज सुपरफिशियल, 5 इज मीडियम एंड 6 इज डीप। देन मैं आगे बढ़ूंगी 1 2 3 4 5 6। इसी तरीके से मैं पूरे ब्रेस्ट को सेंटीमीटर बाय सेंटीमीटर एंड लाइन बाय लाइन पूरे ब्रेस्ट को एग्जामिनेशन करूंगी इस तरह से। और फिर 0 के ऊपर यदि हम प्लस पॉइंट मानते हैं और 0 के नीचे माइनस पॉइंट। इसमें हमें किसी भी एरिया में जो कुछ भी फील होती है अबनॉर्मलिटी, उसको हम अपने फिंगर से फील करते हैं, बिकॉज हमारी फिंगर का मेजरमेंट है। कुछ भी एबनॉर्मलिटी अगर हमें मिलती है उसको हम फील करते हैं अपनी फिंगर से, लाइक साइज, कंसिस्टेंसी, स्ट्रक्चर और सब कुछ हम अपने सिस्टम में नोट करके डॉक्टर को सेंड करते हैं। उसके बाद हम जो भी लेडी हमारे पास है उनको सेल्फ एग्जामिनेशन सिखाते हैं। सेल्फ एग्जामिनेशन में बेस्ट टाइम कि आपको कब एग्जामिनेशन करना है, बेस्ट एरिया, किस एरिया पे एग्जामिनेशन करना है, और लंप से अलग कुछ और भी चीजें हैं, कौन कौन सी चीजें हमें नोट करनी है। उसके बाद यदि हमें कुछ भी फील होता है तो हमें डॉक्टर के पास कब जाना है, उसका बेस्ट टाइम, ये सेल्फ एग्जामिनेशन में आता है। कुछ भी जो हमको फील होता है ब्रेस्ट में, पूरा डिटेल हम अपने सिस्टम में नोट करके डॉक्टर को सेंड करते हैं, फर्दर एक्शन डॉक्टर का होता है। थैंक यू।
Thank you, Neetu. This is how she is going to do the examination. Uh, every MT knows the measurement of their fingers. So जब भी वो examination करते हैं with the help of palpation, जो अभी नीतू ने आपको दिखाया, they can detect a lump of this small size. This is 0.5 centimeter. This is half of our index finger. Sorry, Dr. Mandeep, you want to say something?
Yeah, Sonal, can you just put that PPT on once more? Yeah,
Yes, sir.
thank you. So as Neetu has explained you how they go about doing the the medical tactile or tactile breast examination. So the whole concept of discovering hands or tactile breast examination is that the tactile part of breast screening needs to be advocated in much better way. There was a paper from SGPGI Lucknow in which they suggested that if there is a routine habit of self-breast examination in Indian women, it can make a sea change in the survival rates of breast cancer in India. There was another paper from Tata Memorial Hospital which suggested that in India, if a woman who's an examination which is done by a trained medical personnel for individually or a trained medical personnel plus mammogram, the detection rate more or less remains the same. So that is why what we are trying to advocate is that every woman should do a self-breast examination every month, followed by 6 monthly to 1 year examination by trained medical personnel. And if that trained medical personnel can be a medical tactile examiner. So as you can see in this slide, if a woman who herself is doing a self-breast examination, she'll be able to catch a lump of around 2.5 millimeters, that is around stage 2, 25 millimeters, that is around stage 2. If that tactile examination or a breast examination is done by a trained gynecologist, she'll be able to detect a lump of around 2 to 1 centimeters, that is 20 to 10 millimeters, that is around stage 1. And if that the same examination is done by a medical tactile examiner, she'll be able to detect a lump of as low as 6 millimeters. And beyond 5 millimeters, it is like beyond the human touch. So these, so visually impaired, but yes, with better sense of touch, who are trained to do breast examinations, when uh, these ladies come into the fray of breast cancer detection, they are able to detect breast cancer at much earlier rate. They are very thorough in their examination. It can be done for women of all age groups. Like if I'm looking at 45 years of my peak age of incidence, I'll be able to start screening at 30, 35 years. And also the fact is that self breast, then tactile breast, and then mammograms. We are not saying that this is alternative to mammograms. We are saying that a woman who is doing screening mammography actually is screening mammography, that is before the lump is even felt. So if you are able to catch it yourself, fine. The lumps which are missed in self breast can be detected by the tactile breast, and that is missed even at the tactile breast is actually detected at by mammogram, which is at stage 0. If we club all of this together, then we are able to actually catch majority of the women at breast cancer at very early stage, and survival can be as high as 90%. No woman will lose her breast, and around 50% of the women can be treated even without chemotherapy. So these are the important implications of uh, putting these efforts in breast screening. And I think if Sonal, you want to add anything, it would be fine.
No, sir. I think you have covered everything, and thank you so much for giving all the insights. And yes, we are bringing this examination to Arya, and Pragati will be taking the registrations so that we will give you time slots. So whoever is interested for the examination can give your detail to Pragati, and she can give you the time slot accordingly. And we are open for question and answers if anyone have any.
Sure, Sonal. So before proceeding for the Q&A session, so I request everyone, like you people have gone through the presentation, the detailed discussion which Sonal and Dr. Mandeep had. So now you know the process. So I would request like to just give a deep thought to it instead of fearing and like not going ahead. It's not a solution. I would suggest it's an opportunity for all of us, and let's take this ahead. So we'll be putting our first camp at Noida head office. So whosoever, like I'm seeing 29, 28 participants over here. So whosoever is from Noida office, I would request everyone to give your registrations. We'll be sharing the link soon to you of the Google Sheets. So accordingly, the number of people or the participants will be receiving will be giving you a dedicated time slot when and where to attend it. And accordingly, you can block your time. So now we can start with the Q&A. So anyone has any question? Anyone who would like to ask?
Yeah, Pragati, this is Madhuri here.
Yeah.
So what is the age till as in there's a woman who's got menopause at about 54, 55. So can we have a breast cancer after that also?
Yeah, Madhuriji, breast cancer can occur till like as the age increases, the chances of breast cancer increases or any cancer increases. So, but the thing is that as a woman, when the age is more than 75, 80 years, we normally don't advocate screening beyond that age. But till 75, 80, definitely uh, screening should be done. At least a self breast or tactile breast can be done. Should be done actually.
Okay. So there is nothing like a decrease in risk or anything after 55 also.
No, no. Actually, the chances of cancer increases, but there's an irony. The irony is that when a younger age group we are having a cancer, the cancer is more aggressive. Whereas if the cancer occurs at an older age group, the cancer is generally of the non-aggressive variety.
All right. And usually
But
the
yes, it needs
cancer
to be
is detected even
detected.
during even during puberty. This can happen.
Normally, we are not seeing. It's very rare that we are seeing breast cancer at such younger age group. Breast cancer normally is when we are seeing is it starts around 25, 30, 35, and then it goes up to 80 years. So that is the general age group. And 45 is the peak age of incidence.
Okay, 45. And
Yeah.
do you have anything like prevention or a precautionary lifestyle measures?
Lifestyle changes definitely we should do. First of all, healthy lifestyle for less stress, um, at least some physical activity, control the weight, uh, substance abuse should be limited. So
So
these are
you are saying
general.
obesity is a factor?
Yes, yes, obesity is definitely a factor,
Okay.
and then these are certain lifestyle changes and certain changes like obviously I'm not. There are certain circumstances which we live in, so I cannot change my environment. I cannot. We all have to work and earn a livelihood. We cannot go to Himalayas and start living there. But the other is aspect what we can do is that definitely a woman should plan a timely pregnancy if she wants to plan. Timely means that we are not saying that now 25 is the but 30 35 should be the time when a pregnancy should be planned. And obviously, I think lactation should be carried out till at least 4 to 6 months. And now, since we are lot of us are into the because of the assisted reproduction which is coming forward, whatever circumstances, I'm sorry, that we go into this. So assisted reproduction also increases the chances of breast cancer. So somebody who is getting into IVFs or assisted reproduction, they should start doing diligent self-breast examination so that if something like this occurs, they are able to catch it early. And obviously, they should take care of tactile breast examination like initiatives.
Okay. And I mean, I don't know if I should be asking, apart from cancer, is there any other breast ailments that we need to look out for?
Then there are small breast lumps, fibroadenomas, fibrocystic disease, which there is breast pain, and then breast abscesses and all. So that is a separate part of discussion we can have sometime later somewhere else.
Thank you, doctor. Thank you so much.
Sonal, I'll leave. Okay.
Anyone else? Anyone who has a question?
Thank you, Pragati. Thank you, Sonal.
Hi, one more question. Is there any effect due to early menopause also?
Early menopause, actually, the thing is that when we are looking into breast cancer, we are looking into the estrogen exposure. So that is something which is sometimes which correlates. It is not every time it correlates, but majority of time it correlates. So early menopause actually has some beneficial effect when we say, yes, early menopause has its own problems, like you'll have more osteoarthritis, osteoporosis, heart disease is higher as compared to, but early menopause definitely has decreases the chances of adverse breast cancers. Adverse breast cancers, like breast cancer also has varieties. So there is some aggressive cancers and some there are non-aggressive cancers. So by early menopause, the chances that the aggressive variety of breast cancer slightly decreases.
Okay, thank you.
Thank you guys. Thanks a lot.
Yeah,
Thank
सर
you.
जिसको
Thank you.
पीसीओडी प्रॉब्लम है उसको चांसेस जल्दी होते हैं क्या?
पीसीओडी के
हेलो
साथ अगर उसमें हार्मोन चेंजेस हो रहे हैं, मतलब ईस्ट्रोजन लेवल ज्यादा है, तो
या हार्मोनल
yes,
इशू या
yeah, so she should be more careful. Yes.
ओके ओके
देखो, I'll tell you one thing. I'm not to get scared out of it. These are all relative in risk factors. When I say relative risk factors, is that yes, somebody who has early menarche, somebody who has PCOD, somebody who has assisted reproduction, somebody who has been given hormones for some other reasons. These are risk factors which increase breast cancer, but there are also other risk factors which also contribute equally. Like the environment contributes equally, the lifestyle contributes equally, the substance abuse contributes equally, even stress contributes equally. So it is a multifarious. It's just not that if somebody is having, if PCOD will definitely get breast cancer. It's just that PCOD there is slightly more risk as compared to the other woman. But if she's having a healthy lifestyle, timely pregnancy, she takes care of it. So she might be having a lesser chances of getting a cancer. So it's just not, we are not looking at one factor in as one as a sacrosanct that you have one factor, you'll definitely get a breast cancer. Even if somebody has a strong family history, which, like if you might have heard about Angelina Jolie, and so she had a very strong family history. She took the extreme step of getting her breast removed, getting her ovaries removed. So that is a discussion which we might have sometime else. But what I'm trying to tell you is that even in that high risk family history, the chances of getting cancer are just 60%. 40% she will still not have a cancer. Yeah. So that is how it is.
So during the session, we had shared a slide which Dr. Mandeep had explained. There are multiple factors which will contribute to breast cancer. So it's not necessary that if you are having any one factor, then you will have. But if you, it's not sure. So you have to look for whatever symptoms. Keep doing self breast examination and go for regular tactile breast examination and radiology. So that will help you. So Pragati, do we have any more question?
I think no. We can close this and probably we can start with the registration process internally. And
Yeah.
maybe by Wednesday, I'll confirm you sooner, like how many people and what date we are targeting for. Okay.
Yeah.
Thank you
Thank you
so much
so
for
much,
your time.
everyone. Thank you so much, Dr. Mandeep, for taking our time.
Thank you, Dr. Mandeep. Thank you, Sonal. Thank you.
Thank
Thank you.
you, Dr.
Thank you,
Mandeep,
doctor. Thank
and
you,
thank you,
Sonal.
Sona, and
Thank you
thank
so
you
much, Pragati.
for organizing this session. Thank you, everyone.